You like your achar though, right? That's the home. Welcome to the office. Ranveer, welcome to the office.
Thank you.
Nice to meet you.
Nice to meet you.
So you're coming from Edmonton, Canada,
Correct.
Alberta.
Yes.
Alright. And what are you doing here? How can I help you?
I have an issue with my back,
Okay.
lower back mostly. I have a sharp pain when I'm working in the when I used to work in the field. So after a little bit after working
Like in the farm?
like when I work in the field, right?
Not
Like not in the
joking.
farm. Yeah. So I do get a very sharp pain sometimes when I go up the ladder, when I go down,
Okay. When you go up or down? Or both?
both.
Okay.
So then I have to just sit down, just relax. Then the pain a little bit goes away after some time. Then I can start working again. But again, then I won't be able to work 100% because I can feel that the pain will come back again.
For how long has this been going on?
I think 2 years now. I think.
What happened 2 years ago? It
I'm-
just happened
it
all of a
happened.
sudden?
Yeah.
No injuries you remember? I'm going to show you some, but okay.
Mhm.
Nothing you remember, right?
No.
Okay. And you've been doing this how long?
4 or 5 years.
4 or 5 years?
Yeah.
This is the work you've been doing?
Yeah, yes.
Okay.
And usually when I get up in the morning, I cannot get up straight. I have to be on the side. Then I just hold my leg to stand up.
Left leg?
Yes.
You push from your left leg?
Yeah.
Okay.
Then I have to get up so I can then I have to like my body stays a little bit like on the angle like a bent. I
Mhm.
cannot straighten my back for some time. Like after 1 hour, like after doing some little bit exercise,
Mhm.
then I can make me stand straight. But usually most like within like I would say
You can't straighten because of stiffness or pain?
pain.
Okay.
I do feel like a lot of pain on left
side.
Yeah.
Yeah.
Then slowly I think when your muscles get relaxed a little
Mhm.
bit, then I can straighten myself, right?
Okay.
So this started getting worse about 6 months now. Before it was like not bad. I used to work in the field. I was like okay, like it take me like 5 minutes to go to the field and work. But right now from 6 months, it's taking 1 hour, 2 hours to get me used to walking or
Oh wow.
standing up.
Okay.
Yeah.
You saw some people for this over there though?
Yeah, I've seen like one chiropractor like 2 weeks.
Mm-hmm.
It did help me a little bit, but again the thing came back.
Do you know what your issue was? Did they tell you what your issue was?
He told me that there's your body's just shifted a little bit. That's what he told me, and there is an issue.
You do data, right? You do cabling and
Yes.
internet and all that.
Yes.
So, and you know about switches and all this stuff,
Yeah,
right? I'm
yeah.
going to explain it in that term.
Sure.
And if you're general with your client, what does your client tell you?
But like if I did proper job,
Yeah.
he said yeah you did excellent job, and he just gives
No, I'm saying is you want to know specifically, right? If you're working on a switch,
yeah
is it number 10, 11, or 12? Which port is it? Where's the congestion?
congestion in the congestion usually in the basement, right, where the main stuff is.
Correct,
Yes.
exactly. But the thing I'm saying is that you weren't actually told what your issue is.
Yes.
You don't know what number, what it is.
No.
Okay, just generally something
Generally,
is off.
Something is off.
And you know you're tilted, right? You know
Yes.
your pelvis.
Yeah,
They took
then-
x-rays?
They took X-rays,
Okay.
and when I did one MRI when I
Mhm.
was back home in India, they told me L4 L5 issue. Is it that? I'm not sure.
No.
I think then you might
That's
have.
not it either.
They did MRI, right? So
I'm going to give you your answer, don't worry.
yeah.
Okay. All right, so number one is your back. It's stiff, it hurts, it takes a while to get up
Yeah.
and going. It's been getting progressively worse over
Yes.
the last several months.
Yes.
Take any other issues going on? That's your number one.
So next one is like when I get up, I stay like this in the morning.
Yes.
So I cannot
To
straighten.
the left.
Yes.
Yes. And you sleep on your left or right
Yes.
side?
Left side.
Got it. Okay.
So
So
it's
you're on your left, tilting to your left. You get up. It's hard to straighten out.
straighten. Yes.
I got it. Okay.
Yeah.
And all right. So what I'm gonna do? Let me go over your X-rays. I'm gonna. I think it's gonna make a lot of sense when I explain and show you what's going on. Then what we'll do is we'll examine you
Mm-hmm.
and we'll figure out where you're gonna start. You're here for at least a week, so we have some.
For 10 days.
Okay, so we have some good work we can do, inshallah, in these next few days, next week and a half. Okay. You have questions along the way, you ask.
Sure.
If you're uncomfortable with anything, you tell me to stop. Okay?
Yeah.
I want to make sure you understand the problem before I actually touch you.
Correct.
Okay? Yeah. All right. Shall we get started?
Sure.
This is you. This is a picture in time. It tells us how you've evolved since birth. This is your right side. This is looking at you from the back profile. Okay? This is your 24-story building. This is your side profile. And we'll be going back and forth through a couple of things. And we're going to start on this x-ray. And let's talk about this. So we said this is your 24-story building or your 24-port switch. This is the foundation of your 24-story building. In order to have a stable building, we need a level base and foundation. So the first thing is, do we have a level base and foundation? No, we do not. And you should be able to see very clearly you have a tilted pelvis on the left side with a short leg or a lowered leg. We'll use that word, okay? Now, we have misalignment of the pelvis. We have a tailbone injury dropped on the left side 4 millimeters. But let's talk about this first. Let's talk about the foundation and the leg length inequality first because it's really important. In this work, Dr. Gonstead found, as long as there's under 7 millimeters leg length discrepancy, adjustments will hold. That is normal variant. Your 14 millimeters measure difference. If with correction of your pelvis, we can probably get 12. That's the 80 actual difference after correcting. 4 of it is coming from the sacrum. So now we're at 8. So the question and what we're going to do is we're going to be seeing you a bit. We're going to re-x-ray it next week. And we may need to put a heel lift on your left side. It is a possibility. I'm not saying yes or no yet. I've seen things happen. We'll see. Now, why is this important? This short leg, you're tilting, yes, on the left. You're sleeping on the left, so you're curving. You're sleeping like this. Now, you're already tilting down, so all this is tightening up. Now, you're trying to straighten out is too challenging until you move. So our goal here is we need to get that left side up. That's your first answer. Take? Make sense?
Correct.
Okay. I'm going to switch over here for a reason because we talked about a tailbone injury and there it is. Coccyx S5. You can see it's open wedge there, tilting forward. So we need to work on, this is probably where we're going to start. As we look through here, there's a little nub here, but that's okay. I'm all right with that. Maybe there's something there. You have an open S1 in the back here. Okay. Now, you have an old pars fracture here. You have an old fracture.
Because that's where I'm getting sharp pain.
It's healed. I'm saying, but it's an old injury.
Old injury.
So you played hard. What did you play? Cricket? Football?
I was playing cricket.
Heavy?
Not too much, but I used to play in the ground.
What else? You used to be very active.
Yes.
Yes?
Yes.
Rough.
Yeah. In the work too, right? I used to work very hard too.
I understand.
Because I have to take my basically carry my tool bag every time.
Yes.
On my waist. So.
Okay, so it makes sense to me now. So we have a tailbone injury and we have S1. This is an old pars fracture. That's okay. I'm just telling you that there's old injuries that led to this. What caused this to go down though? I don't have that answer right now. Okay. So let's go back here. Now, here's what I want you to see, dude. And what I'm about to say is, I've said it before, I've said it in older videos, and I'm going to say it again. You're tilting. So what do you think's happening here? Look, you're tilting on that left. You're tilting like that. Isn't that open on this side? Yes. It opens the wedge?
Correct.
Okay. Now, here's the thing about non-weight bearing images for weight bearing structures. Your spine is weight bearing, should be imaged weight bearing. In lieu of specific injuries, hard traumas, fractures, tumors, this, that, just basic mechanics. Take. You're weight bearing. Okay. let's say this is the stuck segment.
Mm-hmm.
What we know about the spine is 2, 3, 4 segments will compensate to make up for the stuck joint. And I used to explain it a little different, so I'm going to go a little more specific for people because so they understand. Because a lot of them aren't going back to the older videos where there's more knowledge there. Okay. There's a concept of global motion of the spine and intersegmental motion of the spine. Mm-hmm. Global motion is this. I say, hey, bend forward and touch your toes. That's the whole spine moves globally. Yeah. Each segment has to move a certain amount intersegmentally. Yep. And totally creates the global motion. Mm-hmm. There's a textbook that we use, Clinical Biomechanics of the Spine, White and Punjabi. They were actually the authorities in the spinal mechanics. Mm-hmm. And they quantified each bone and how it moves and how much. Mm-hmm. Now, if this one is stuck, these become hypermobile. Mm-hmm. If I put the person on the back for an image, the stuck segment doesn't move. Yes. The hypermobile segment moves, appearing to be a false positive. I've seen it in 90 to 95% of the MRIs that have been brought into my office in 20 years.
That's why when we lie down, we don't get an actual thing, right? Yeah.
Make sense?
Yes.
I'm talking, you're a mechanical guy.
Yes,
it's mechanics, dude.
Yes. Yeah.
Okay. So whatever's going on here, that's 5, that's 4. Maybe there's something there, but that's not the cause.
That's not the cause, correct.
You know, B.J. Palmer, I'm going to give a funny story real quick. Just a funny story. So B.J. Palmer was the developer of the profession, and he was a great orator, great storyteller. So he used to give these very, very basic analogies, right? And just as you said, is the stuck segment doesn't move, the hypermobile appears to be false positive. So he gave a very simple story. And the man is walking down the street, and he sees a dead cat. And he's like, I wonder what killed the cat. And he turns the cat over, and there's all maggots everywhere. Maggots killed the cat?
No.
He gave another funny story. You got rats everywhere because of all the trash and garbage. Gassia. Get rid of the garbage, you get rid of the rats. Right? So cause and effect. Right? Well, it's a funny story. I just wanted to share that. Now, so the maggots didn't kill the cat, did they? They showed up afterwards.
Afterward.
Got it?
Yeah.
Now, you see this? It starts to tilt left side, comes back to neutral, and then you have another hard kink here. Goes to the right, then another hard kink here. This is all compensation, brother. And it goes all the way to the top. We also have a right deviated jaw. If you want me to work on that while you're here, I'll work on your jaw as well, and your nose, your septum as well. Okay? Those are bonuses. That's not what brought you here.
Thank you.
Let's go back here now. Let's talk about your digestion. Your veg, non-veg.
I would say like 90% veg.
Okay. I'm asking because I'm looking digestion is off also. And when I'm looking at digestion, I'm first looking at this little gas bubble here called the Megan-Blasi. The shape is good, but it should be this big. This is all undigested food going through the colon. I'm not going to give you anything for a couple of days. We're going to see what happens with the adjustment and if it changes the digestion. If I have to give you something, I may. Because control of the digestion is going to happen from up top there and especially in this kink here.
But for the food wise, like I get hungry, I eat a lot. Because like I don't feel like I'm not feeling hungry. I usually eat like 3 times.
That's great. I'm saying though you're not digesting your food properly. You're not absorbing and assimilating. So you're producing inflammation in the body, and that inflammation is contributing to your pain.
Yes, okay.
And I'm going to show you very simple solutions. Okay? Take. We have T1, T2, T2 side slip, T3 side slip. So we have something going on in the upper back here. T2, T3, we have something going around T7, T8, and we have the tailbone, and now let's get back to this pelvis and talk about it, because we need to figure out this thing here. I'm going to need to work on your pelvis, yes. I'm going to need to work on your tailbone here, and I'm going to need to work on all that. Once that's all set, now here's the interesting part. If we look here, and this is where I get my answer, okay? So if we look here, we know this pelvis is down on the left side, and we know that the hip is down on the left. A PIEX versus an ASIN. This means that the left pelvis is down, the right one is up. Now, my suspicion based on the x-ray, but I have to find it on you. If I look at your side profile, you have a straight spine. A straight spine, meaning you don't really have the curvature. There's no real curve here, and this is a reverse, okay? Before I talk about what I want to, let's talk about the discs. Overall, your discs are good, okay? It's a little less here. These are good. They're compensating, though. You see these circles?
Yeah.
It's all because of the curve. Now, these discs are all good. These discs are all good. I can see here and here they're good, okay? But that's the kink. These discs are all good. This one is tilting back 2, 3, 4, 5, 6. Che. So we have to look at C6 there. But the point now I want to make is when we look at a straight spine, or we call it the poker spine, that usually comes from an AS or IN ilium. Why? So here's the mechanics as was explained by Dr. Gonstead and the mechanics of the spine. This is the pelvis, this is the sacrum. When the pelvis goes up, it causes the sacrum to go back because the process is called nutation, counter-nutation, the way this works. So if this goes up anterior and superior, this is going to come back, causing a straightening of the spine. If you had a lot more curve in there, then I would say, hey, that's more a PIEX. Now, that's the mechanics and the theory. It's what we find on you. But I think to get this curve back, we will need to work on that right pelvis. Now, if I bring this up, it brings it up. If I bring this down, it still brings it up.
So what should be the level, like 14 MD, 12? It should be
under 7.
Under 7, eh? So is it possible to bring it up?
Well, that's what I just explained, right?
4 of them.
2 of it is from here, 4 is from here. That's 6. That gets to 8.
8.
So I got to put a little bit more masala in there. As much as you're gonna let me do, I can do. Okay. I'm joking a little bit, but I'm also very serious, right? I gotta put some
pressure.
I gotta put some oomph in it. And then we'll see on the re-X-ray. I'll see you probably. We'll do about 10 adjustments and then re-X-ray. And for the re-X-ray, maybe we'll do the whole thing. Maybe we'll just do the pelvis, just to kind of see, because that's the key. If we don't get this under 7, nothing's gonna hold, according to me.
Yeah, because that's a base, right? Yeah.
That's it. But the good news is we can still put a lift there if we need to, and you will need it in all your shoes if we need it. Okay, ready to get started?
Sure.
Have a seat, sir. And I'm gonna watch you walk to the corner of the room and back, please. Walk to the corner of the room. And we're looking at his dimples, and he don't got a lot of movement in those dimples. You're gonna walk 3 or 4 times. Swing the arms, please.
Arms too?
Yeah, this way. Swing. There's no movement in his dimples. He externally rotates his right foot. You would expect, you can see the tilt. He compensates well, so you tilt down when you walk.
Yeah.
So your shoes are probably worn out more on your bottom left heel. If you look at your shoes. So just like we're changing alignment, I mean, those are really nice shoes. Hopefully they're not too old.
No, they are, I didn't use them a lot, not too old.
Okay. Because once we start to change the alignment, we gotta change the tires, right?
Yeah.
Right? Walk again one more time, please. Okay, have a seat, let's get started. All right, let's run the meter on the back, starting at the base of the neck. And the first thing we're getting is C7. Left side. 11 points, C1 up top. 10 points, T7, left side. You came with wife and baby?
Yes.
One?
One, yes.
One baby. How old is your baby?
2.5.
2.5. Shukr. There it is, brother. Down low, starting in the S5. S5.
Something gets stuck when I feel a sharp pain.
Yeah.
When I feel a sharp pain, so something that's getting stuck, right? Something?
Yes. That's the inflammation, that's the nerve pressure. Dekho. Come back slowly. I want you to see something. Keep your head straight from me, brother, please. Thank you. Panch. That's 5. Tender? Yeah? That's 4.
Yeah.
Sharp?
Yeah.
Okay. So 4 is swollen. 5 is swollen. But let's keep going. 1, 2, tender.
Yeah.
I'm in the basement now. 3, tender.
Yeah.
I'm going down. 4. Yes?
Yeah.
So this is where I'm finding it start.
Yeah.
Yes?
Yeah.
Come back again. 5. 1. This is 4. I know it's tender.
Yeah.
1, 2, 3, 4, 5. That's where it's starting. So after I adjust that, we're going to retest L4, L5. You'll tell us what's different, okay?
Okay.
Head down, sir. Static. 7, 1, 2, 3, 4, 5, 6. 7 more tender, 8, 7. 6 more tender or 7 more tender? 8, this is 8. That's tender. That's 7. More tender. 6. Tell me which one is more for you. 6, 7, or 8?
7, yeah.
This one.
This one, yeah.
7.
Yeah.
Take. Sorry, he's sweating now. S5, T7. Now let's check the neck. 7, 6, 5, 4. Bend right, bend left. We're going to wait on the neck. I'm getting it more at C1. Sit up straight, please. And last thing I want to do is let's check actually the pelvis. We didn't check the pelvis. Feet together. Keep your feet touching. Open your knees. Close your knees. Open and close. 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 Right side only. When he does the right, you see the whole left shift. Left side only. When he does the left, the right shifts also. Okay? So we'll check that afterwards. We're not at the pelvis first. We're starting in the sacrum. So here's my game plan today, Ranveer. We're going to work on S5, T7. Then I'm going to recheck the neck. After that, I'm going to have you walk. And we're also going to see if the dimples changed and the pelvis is moving better. That's where we're going to start.
Sure.
Okay? You ready?
Yeah.
Chalo. Face down. Shasha! Was he behaving, Shasha? Give him some good food options. They're here for 10 days, okay? Come.
Okay.
Hands here, palms up. What's your favorite food?
Usually, I'm not from South, right? I'm from North India.
So what do you eat in the north?
North is like, saag and makki di roti, you know all that, right?
Oh, you want roti?
Yeah.
Oh, you eat mutton?
No.
Oh, you want proper,
I can eat chicken.
you can eat chicken? Some karai chicken?
Yeah.
He wants karai chicken and roti.
Which is favorite restaurant here?
Huh?
Which is a good restaurant here, we didn't find it.
I'll tell you some good ones off camera. They're not sponsoring the video, so. Unless you really want to, guys, just send me a message. All right. Shasha, okay? I'm going to use the drop board, okay? So it's not too spicy. You like your achar though, right? That's the home run, brother. Nice. Thank you, Shasha. Sat. Home run, baby. Now, I don't want you to walk just yet. I want you to go right side. I know it's spicy, right? Actually, you can walk once. Walk once. It's going to be a little weird.
Yeah.
Let's go right side down, please. Bottom leg straight, top leg bend.
Yeah.
Now you'll see the difference in this side adjustment, okay? Now we're trying to keep everything neutral, sir. I'm going to be on the outside of your underwear because I got to be low. Okay? You have to roll with me, brother. Let it roll. Let it roll. There you go. Got it. That's the home run. Put up. Walk up.
Head up.
Come up slowly and let's walk. That crunched. Walk it off this. Well, 3 times is going to feel very different now. Mm-hmm. Mm-hmm. Have a seat and let's recheck now the upper. Just sitting should feel different right now, right?
Yeah. Changed something.
Take. That cleared the base, but the top is still there, so we're going to do C1. Mid back is clear. Low back is clear. Sit back here for me, please, and let's check out your upper cervical now. Another misleading one. C2 left, C1 right. Wow.
Too many problems.
Oh, no. Too many compensations to the original problem. C2. Let it go though for me, brother. Now, for C2, we got to bring that elbow down. Look up. Oh. And now we do C1, okay? Now, because of C1's angle, I'm going to try to be level with him. C1. There. Jordan. Us. Home run. Beautiful. Let's walk, sir. I don't think so much. Just walk. I don't think so much. Just walk. You'll see. Keep going. Now we got movement in your dimples. You should feel more balanced now. One more time. Walk it off.
Do you think my situation is more complicated, or it will just be more complicated for these ones?
Everybody is unique, brother. It's not what it looks like, it's how it's affecting your quality of life.
Yeah.
I can see somebody that their x-ray looks great and they're debilitated. I can see somebody whose x-ray looks really bad, but they don't have a lot of pain.
Yeah.
Okay, your issue is mechanical.
Yeah.
And there's a few things, you have a few injuries that have built up over time. And you know, we tough it out and we get through it and we got life to deal with, right? But then they accumulate.
Yeah.
And then finally enough is enough and the body can't take it anymore.
Yeah.
And that's where you were at. That's why you're here. Come back. Check it out. There you go.
Yeah.
Right? There you go. Now, that's 5. Different? That's your 4.
Yeah.
Tender, but different.
Different, yeah.
And if we need to get to it, we'll get to it. But that's not where we're starting. All right. Now you get buff and polish. Vibration therapy. Frequency is 170, 180 hertz. Or you can say 10,000 cycles. And this is just breaking up scar tissue. When it goes over normal tissue, it does nothing. When it goes over scar tissue, you feel that little tickle spice feel. Squeeze. Relax. Squeeze. Slow. Elbow. Let it go. Squeeze. Slowly. Let it go. Let it go. Slowly. Let it go. There. Squeeze slow. Relax. Yes. Nice. Questions for today? You understand what I found?
Yeah, I did.
Okay. That's where we're going to start.
Mm-hmm.
Okay. Shasha will give you some homework.
Mm-hmm.
She'll give you some restaurant options as well.
Mm-hmm.
And let's start this journey.
Okay.
Welcome to the office.
Thank you.
You're very welcome.